coughing bout starts? When did
This
begin?
coughing I have all the time. From when I was very young, I cough. But cough with blood come only in the winter or come when it's too much in my body. So this blood, 3 weeks ago it starts, okay? But now it's a lot of blood. Usually, it's a little bit blood, no problem.
Okay. And this coughing has stopped you from sleeping? It's impaired your daily life?
No, yeah, of course. I go to sleep. But because I lie, my chest become very heavy. Like this.
I understand.
I feel like I have something. And I start coughing. I wake up. Coughing and coughing and coughing. I need to stand for breathing.
Okay.
And then I stand, I take cigarettes. I cough again. Oh, you don't know. What's the problem? I'm only 30 years old. I feel like someone 70.
Okay. Well, the cigarettes may help you feel better in the very short term, but overall they're damaging. We'll discuss that later. But first, I'd like to discuss this cough. You say it's been going on your entire life.
I started to smoke when I was 10.
Okay. First, I'd like to ask, where were you born?
I born in Russia.
In Russia, okay. And where did you go from Russia? Did you come straight to Israel?
I come 94. I come to Israel. I was 16. I come by myself. And I come, just me. I used to live in the street for a long time. Now 3 months I live in an apartment with the people.
Okay. What type of apartment is it?
Well, what should I tell you? The apartment is in the center station. We have 2 rooms. We sleep 3 people in 1 room, 6 people in the apartment.
Okay.
It's very dirty.
Okay.
Well, it's a good apartment. I say thank you, I've got this apartment. No, in the winter.
Okay. Well, it's very important. Okay. Between moving from Russia to Israel, have you lived anywhere else, or have you traveled to any other location?
No, I came from Russia to Israel. I live in St. Petersburg.
Okay. Do you have any family?
No.
You don't? Since the time you were born?
Well, I used to have a mother and a father, but my father died when I was very little. He had this TB, he had blood on his, come from his neck. After a while, he died. I didn't even know him.
When was this? How old were you?
Oh, I was 2 years.
And you said your father was diagnosed with TB, tuberculosis?
TB, yes. Okay. My mother, she's married with another man when I was 10. She threw me for the house when I was 10.
Okay. Okay.
I started to live in the street, but then I did this aliyah, I came in.
Okay. Since you were younger, you've been living in the streets. You haven't had a steady home. Is that to my correct understanding?
What if I don't have?
You've been living in the streets since you were younger.
Yeah, you're very younger, yeah.
Do you know how old you were?
When I was starting?
When you began to...
No, you see, I was a naughty, so from when I was 10, I just living in the street, come back home, living in the street, come back home. But then, when I decided to come to Israel, my mother, she helped me to come, but after I came, she don't want to sleep with me. So I am here in Israel. I live in the street for a long, long time with a friend, with people, in the beach, in the winter, in the summer.
I understand. Okay.
Then sometimes I have a room, sometimes no, sometimes I find in the beginning I used to meet ladies sometimes, but now not anymore.
Okay. I'm going to go ahead and ask you some more personal questions, and as I said before, it's important that you answer truthfully. Are you alright?
No, I'm not alright. I'm bad.
I understand.
I feel horrible.
But we need to continue this interview in order to best help you. It's in your best interest if you understand.
You please just give me to smell it.
As
just
I discussed
smell.
before, it's out of the
no,
question.
just
out of the
smell.
question.
To smell. Okay. I just keep
You're going to leave this down.
Okay.
Here. You know what? It would help if you put your feet forward and we'll examine you. Okay? Put your feet forward. It'll make you more comfortable. See? Okay? Okay, now I'd just like to ask you the questions I meant to before. Okay, just sit forward. Do you do any recreational drugs? You mentioned before.
No,
you did
never.
once.
I never take drugs.
Never in your life?
Never.
Okay.
Okay.
No needle sticking?
No, nothing.
Are you sure?
Yeah, I'm sure.
Okay.
I just smoke this crap and drinking
see.
these bad things.
I see that you brought some drink with you. How long have you been drinking?
From when I was 10.
Have you been on what's called an alcohol binge? Have you been drinking
Never.
very heavily and staying out very late?
I drink all the time.
As you mentioned before, to alleviate the pain.
Hmm?
To alleviate the pain you have in coughing, it helps alleviate.
Yeah, drink helps for everything.
Okay. So for right now, you're going to stay forward, okay? And I'm going to quickly examine you, just to confirm what I think may be the problem, and then we're going to help you out. You'll be feeling better very soon.
Okay.
So, would you mind just exposing your chest area? Well, why don't you take off your shirt and use this rope?
But you know my body, it's so hurt. It's like...
So do it very carefully. Okay. Are you feeling any coldness?
No, I feel cold all the time, like, but you know,
Shivering that you mentioned.
I feel like knife I have in my body, like I want to shake all the time.
You have 3 minutes left till the end of the encounter.
I'm sorry, but we do have a very limited time, so I'm going to have to quickly examine you.
Okay.
I'm just putting this on for protective reasons. Okay. Lean forward and take a deep breath. Can you go any deeper than that?
No.
Okay. Once again, a deep breath. Okay. Again, deep breath in, and now out. Okay. Let me see one more time. Deep breath in, and out. Okay. I notice you're having a lot of trouble breathing. We're going to quickly move ahead since we have limited time. I'd like you to lean back, lie down. With your back straight. I'm going to quickly listen to your heart. Slowly as is necessary. Okay. If you'd like to sit forward, do you need my help?
No, it's okay. It's just...
Okay. It seems to me that you have acquired tuberculosis, possibly from your father, and you may have had this as a chronic illness throughout your life. You can go ahead and put your shirt back on.
What do you mean? Could you explain to me better?
Tuberculosis is where basically your lungs
Yeah.
get filled up with a material, what we call an infiltrate, which makes it difficult to breathe and which
Yeah.
would cause you all these problems that you've been discussing. Do you need some help?
No, it's okay.
Okay.
Then what should I need to do?
Well, there are treatments available, but it's very important that for right now, you don't do anything other than what the doctors prescribe. We're only here to help you.
Okay.
I'm part of the staff that's just here to help you, and it's important that you do not drink.
No, but it's not possible for me not to drink. I must drink. My body needs
I understand. There are medications that we can give while you're here in this setting and you're following our directive.
Okay, no problem.
We'll help you with the pain, but you will find you don't need to, okay? And there are treatments available and we will be able to help you, but it's important that you follow our directive and me and all the rest of the staff.
The encounter has ended. You may leave the room. You have 6 minutes to fill
Okay,
the
so
form.
I'm going to ask you right now to just stay put and I'm going to go ahead
Okay.
and see how we can begin. Thank you.
You're welcome.